It's an experience most of us have had at some point, waking up in the morning and immediately feeling like something is wrong. Maybe you're groggy and disoriented, even after what seems like a full night's sleep. Maybe your body aches, or your mind feels foggy as if you never really rested at all. It's easy to brush it off as just part of aging or an aftereffect of the day before. We've all been told that getting older means we're bound to feel more tired, a little more sore, and a little more sluggish. But here's the thing. While some level of fatigue or discomfort is indeed a normal part of life, persistent or severe symptoms shouldn't be dismissed so quickly. In fact, if you're between the ages of 55 and 75, waking up feeling off could be signaling something more serious, something you might not even be aware of. What if I told you that the sensation of waking up, not yourself, could be your body's way of telling you there's a hidden problem lurking beneath the surface? And what if ignoring it could lead to long-term health issues? It's time to stop brushing off your body's signals and pay attention. It's time to decode what's really going on. We've all heard that old adage, you're only as old as you feel. The problem is, when you're in your 50s, 60s, or 70s, that feeling often starts to shift. Many people begin to associate fatigue, joint pain, and sluggishness with the aging process. But if you wake up each morning feeling less than energized, despite trying to get a full night's rest, it could be more than just aging. It might be a symptom of a hidden condition that requires attention. And here's where it gets tricky. Some of the most common health conditions that affect people over 55 don't necessarily announce themselves in a way that screams emergency. They creep in, almost unnoticed, until they start to take a serious toll on your life. By the time the symptoms become undeniably severe, they've often been there for much longer than you realize. Take sleep apnea, for example. This condition is notorious for being largely undiagnosed in people over 50, and it's especially problematic because its primary symptom is actually something you're unaware of: disrupted sleep. That's right. The very thing that's supposed to be restoring your energy could be doing the opposite, and you might not even realize it. Imagine trying to function on a broken night's sleep for years on end. Your energy levels, your mood, even your physical health are all compromised. It's more than just feeling tired. It's the quality of your sleep that matters. If you're waking up constantly feeling exhausted, despite being in bed for hours, it's worth considering whether a condition like sleep apnea could be to blame. Sleep apnea. This condition involves brief interruptions in your breathing during sleep, sometimes hundreds of times a night. It's a silent thief that steals your rest and, over time, leads to serious health consequences. Studies show that nearly 25% of older adults have some form of sleep apnea, but many don't realize they're affected. You could wake up feeling tired, irritable, and sluggish, and yet assume that it's just your age or lifestyle catching up with you. The impact of sleep apnea isn't just about feeling tired. Chronic sleep deprivation due to undiagnosed sleep apnea increases the risk for high blood pressure, heart disease, stroke, and even depression. It's also linked to cognitive decline, as poor sleep can accelerate the onset of Alzheimer's and dementia. To make matters worse, the symptoms of sleep apnea often seem so mundane that they're easy to overlook. You may not even realize you're waking up frequently during the night, especially if it happens in brief, undetectable bursts. However, your body still reacts to the interruptions. Your heart rate may spike and your oxygen levels may drop, all of which take a toll on your health. What can you do if you suspect sleep apnea? A visit to your doctor or a sleep study can help determine if you're at risk. Treatments such as CPAP, continuous positive airway pressure. Machines can help keep your airways open, allowing you to sleep deeply and wake up feeling truly refreshed. As we age, we often become more attuned to the little aches and pains that creep into our daily lives. A stiff neck here, a sore back there. These are the typical signs we've been conditioned to believe are just part of growing older. But what if there's more to it than that? What if your body is trying to tell you something important? Let's take a look at some other common, but often hidden, health issues that could be causing you to wake up feeling less than optimal. It's possible that what you're experiencing is related to a disease or disorder that can affect your quality of life and your overall health. One of the most insidious culprits behind morning fatigue, joint pain, and even mental fog is hypothyroidism. Hypothyroidism occurs when your thyroid gland doesn't produce enough thyroid hormones, which are responsible for regulating metabolism, energy production, and overall body function. The problem is, many of the symptoms of hypothyroidism overlap with other common age-related conditions, like joint pain, weight gain, and fatigue. So it's easy to write them off as just part of getting older. But untreated hypothyroidism can lead to serious health complications, including heart disease, nerve damage, and even depression. Imagine waking up every morning and feeling like your body is moving through molasses, no energy, sluggishness, even a feeling of heaviness. That's what hypothyroidism can do to you. Your metabolism slows down, making it harder to lose weight and easier to gain it. Your muscles and joints might start to feel stiff or achy, and you might even experience dry skin and thinning hair. If you're feeling unusually tired, gaining weight for no apparent reason, or experiencing changes in your mood and energy levels, it might be time to ask your doctor to check your thyroid function. A simple blood test can reveal whether your thyroid is underactive, and if it is, hormone replacement therapy can help restore your energy and health. Another condition that can cause persistent fatigue and leave you feeling wiped out in the morning is chronic fatigue syndrome, CFS. Unlike the occasional tiredness we all experience from time to time, CFS is a condition marked by extreme and prolonged exhaustion that doesn't improve with sleep or rest. The fatigue is often so severe that it can interfere with your daily activities, and it can be accompanied by muscle pain, headaches, and difficulty concentrating. The root causes of CFS aren't entirely understood, but there's strong evidence to suggest that it can be triggered by viral infections, stress, or even certain lifestyle factors. For older adults, CFS can be especially difficult to diagnose, as its symptoms overlap with those of other health issues. But here's the catch. CFS isn't just about feeling tired. It can also create a range of other symptoms that affect your quality of life, including cognitive difficulties, sometimes referred to as brain fog, trouble sleeping, and a general sense of being unwell. If you're waking up feeling mentally sluggish or disoriented, and your fatigue doesn't improve after a good night's sleep, CFS might be worth exploring. If you've noticed changes in your energy levels, especially if you wake up feeling drained and have increased thirst or frequent urination, it could be a sign of type 2 diabetes. Often, the symptoms of diabetes are subtle at first, but they can become more pronounced over time, especially as your blood sugar levels fluctuate. Diabetes affects how your body processes glucose, which is your body's primary energy source. When your insulin isn't functioning properly, your body struggles to absorb glucose, leading to high blood sugar levels that can make you feel constantly fatigued. You might feel thirsty all the time, experience blurry vision, or notice that you're more prone to infections. By now, you're starting to realize that waking up feeling off could be a sign that something's wrong, something that goes beyond the simple effects of aging. These symptoms, whether they're persistent fatigue, unexplained pain, or mental fog, shouldn't be ignored. When you allow these feelings to continue unchecked, you could be putting your health in serious jeopardy. Let's talk about what happens when you ignore the body's subtle warnings. It's easy to convince ourselves that these symptoms will pass, or that they're just a natural part of getting older. But in doing so, we run the risk of letting underlying conditions worsen, sometimes without even realizing it. The consequences could range from chronic illness to irreversible damage. Ignoring these warning signs is like driving a car with a warning light flashing on your dashboard. The longer you wait to take action, the more damage it can cause. And just as you wouldn't ignore the check engine light in your car, you shouldn't ignore the signals your body is sending you. When it comes to many health conditions, the earlier you catch them, the easier they are to treat. But if you continue to ignore your symptoms, you may be putting yourself at risk for serious complications. The longer an issue goes untreated, the harder it is to manage, and in some cases, the damage may become irreversible. Let's take sleep apnea as an example. If left untreated, the effects of this condition can spiral into a host of other problems. Sleep apnea is linked to high blood pressure, heart disease, and even stroke. That's because when your breathing stops and starts throughout the night, your body isn't getting the oxygen it needs, which puts a significant strain on your heart and circulatory system. Chronic sleep deprivation also affects your immune system, making you more susceptible to infections and illnesses. The damage doesn't just stop at physical health. Sleep apnea has been shown to increase the risk of depression and anxiety, as the lack of rest can significantly impact your mood and cognitive function. If you ignore the symptoms of sleep apnea, snoring, fatigue, and difficulty concentrating, you're potentially setting yourself up for years of health complications that could have been prevented with a simple diagnosis and treatment plan. The same principle applies to other conditions like hypothyroidism or diabetes. When hypothyroidism goes untreated, it can lead to heart problems, nerve damage, and severe depression. Similarly, if diabetes isn't properly managed, it can lead to life-altering complications such as neuropathy, kidney failure, and vision loss. The longer these conditions go unnoticed, the more likely they are to cause permanent damage to your body systems. And that damage often becomes harder to treat as time goes on. One of the most concerning aspects of ignoring symptoms is how health issues can compound. What starts as a mild symptom, let's say fatigue, can snowball into something much more serious if it's not addressed. Take chronic fatigue syndrome, CFS. For instance, at first, it might seem like you're just tired, possibly from overexertion or stress. But CFS doesn't go away on its own. If ignored, it can lead to an inability to carry out daily activities and cause emotional and psychological strain. People living with CFS often experience social isolation, depression, and anxiety because their symptoms make it difficult for them to work, socialize, or enjoy life. Similarly, diabetes can create a cascade of other issues when left undiagnosed. Initially, you might experience increased thirst and fatigue and maybe some blurry vision. You think, it's probably just stress, and let it go. But untreated diabetes can cause severe damage to the blood vessels, nerves, and organs over time, leading to amputations and kidney failure. It can also increase your risk of stroke and heart disease. The longer diabetes goes unregulated, the harder it is to manage and reverse the damage. It's not just the physical toll that makes ignoring symptoms dangerous. The emotional and mental health impacts can be equally, if not more, damaging. When you continuously experience symptoms like fatigue, pain, or mental fog, and they go undiagnosed, it can take a serious toll on your mood and self-esteem. The frustration of not understanding what's going on with your body can lead to feelings of helplessness, anxiety, and even depression. For many older adults, the emotional toll of declining health can feel like a loss of independence and self-sufficiency. The constant struggle to get through the day can make life seem overwhelming. Imagine trying to enjoy your retirement years or spending quality time with family, but being constantly hindered by fatigue or physical pain that you just can't shake. It becomes more than just an inconvenience. It can affect every aspect of your life. It's easy to fall into the trap of thinking that the symptoms you're feeling, whether it's fatigue, joint pain, or mental fog, are just part of getting older. But here's the truth. Many health conditions can be managed or even reversed if they're caught early. The key is learning how to recognize the subtle warning signs and taking action before they spiral into something much worse. So, how do you differentiate between what's just a normal part of aging and what could be an underlying disease? And more importantly, what should you do if you notice these signs in yourself or a loved one? Let's break it down. As we get older, we all experience days when we feel a little more tired than usual. But persistent, overwhelming fatigue that doesn't improve with rest could be a sign of something more serious. If you're waking up tired, day after day, despite getting what you think is a good night's sleep, it's time to take a closer look. This could be a sign of sleep apnea, hypothyroidism, or chronic fatigue syndrome, conditions that are often dismissed as just part of aging but are actually treatable. Don't assume your fatigue is simply because of your age. If it's affecting your ability to live your life, it's important to talk to a doctor. They can run tests, whether it's a sleep study, blood tests to check your thyroid, or even tests for diabetes. Recognizing early fatigue isn't just about how tired you feel. It's about how it affects your day-to-day life. Do you find it harder to focus or get things done? Are you finding it more difficult to keep up with social activities or family events? These could be signs that your fatigue is more than just normal tiredness. If you've noticed unexplained weight gain or weight loss, it's essential to pay attention. As we age, it's normal to experience some shifts in weight, but rapid or significant changes can point to an underlying issue. Hypothyroidism, for example, can cause weight gain even though you might not be eating more than usual. Conversely, unexplained weight loss can signal issues like diabetes or cancer. Sudden changes in appetite or feeling hungry all the time could be a sign that something's wrong with your metabolism or blood sugar levels. These conditions can have long-term impacts on your health if left unchecked. Ignoring a sudden, unexplained change in weight could delay the diagnosis of a condition that, if treated early, could be much easier to manage. If you find that your clothes aren't fitting like they used to, or you notice your appetite isn't as it used to be, it's worth consulting a doctor. Getting the right tests done could help catch potential issues like insulin resistance, hormonal imbalances, or other metabolic disorders early. Joint pain and stiffness are common complaints as we age, but that doesn't mean they should be ignored. If you're waking up with sore joints or experiencing stiffness that doesn't go away after a few minutes of movement, it could be a sign of rheumatoid arthritis, osteoarthritis, or gout, conditions that require medical attention. Arthritis-related pain tends to be persistent and may worsen over time. If it's affecting your ability to get out of bed, walk, or perform basic daily tasks, it's time to see a doctor. The sooner you address the pain, the sooner you can start treatment to relieve the symptoms and possibly slow down disease progression. Joint pain that's accompanied by swelling, redness, or warmth could be a sign of an inflammatory condition like rheumatoid arthritis or gout. These conditions often require different treatments compared to typical osteoarthritis, so it's important to get an accurate diagnosis from a healthcare professional. By now, you know that waking up feeling off could be a signal from your body that something is wrong. But the good news is, you have the power to take control of your health and make changes today that could improve how you feel tomorrow. It might feel overwhelming at first, especially if you're not used to thinking about your health in such a proactive way. But making small, meaningful changes can have a profound impact on your overall well-being. You don't need to wait for things to get worse. By taking action now, you can manage or even prevent many of the conditions we've discussed.